Hello and welcome to the big picture. The way the swine flu or H1N1 virus is spreading across the northern states has become a cause for serious concern. Over 670 people have died so far and over 10,000 people are affected. The worst hit states are Rajasthan with 191 deaths, 155 deaths in Gujarat and 90 deaths in Madhya Pradesh so far. Some other states including Delhi, Uttar Pradesh, Punjab and Haryana are also affected by the spreading virus. This year's toll is the highest since the last 5 years since this virus was noticed in the United States and spread to other parts of the world, including India. Why is it that this virus is assuming pandemic proportions? How can it be controlled? What has been the role of the governments in preventing this virus from spreading? A whole lot of questions need an answer. We will discuss all this today with Professor Rajiv Dasgupta, Center of Social Medicine and Community Health, JNU, Dr. M. Wali, Senior Physician at the Ram Manohar Lohia Hospital, Preetu Dalaria, Senior Team Leader at PATH, a global health innovation organization, and Mahua Chowdhury, Health Journalist. Welcome to all of you. Dr. Wali, no, this is not the first time we are having this virus in this country, but why has it assumed this kind of proportions this year?
Well, I will add to it. We will continue to have it in future also when the winter season will start next year. So we have to be prepared for that as well. This disease has become a pandemic for India and it will remain there for many years. So we have to slow down our concerns about it. I say slow down means so we have not to react very violently that it is a killing disease. Per se, swine flu is not a killing disease. I repeat, per se, swine flu is not a killing disease. What kills in swine flu is a comorbid condition which patient is suffering from, like tuberculosis, old case of lung disease, bronchiectasis, very heavy smokers, pregnant ladies, very old patients above 60, those who have diabetes, hypertension, coronary artery disease, transplant patients who are on steroids. These are the vulnerable group who will die after an attack of swine flu, even a mild attack of swine flu. So the cause of concern is to know about it much ahead. When we were actually talking about Ebola, I came to your studio, that was the time we should have talked about swine flu. Now the swine flu, I would say it is declining. As the summer will set in, it will vanish.
So this is a seasonal thing?
Yeah, it is seasonal thing, and this, as you said very rightly in the initial part, Northern India had a prolonged winter this time, and even mornings are cool. Today the morning temperature at 6 o'clock was 17 for the first time. Yesterday was about the same. So now the weather is changing, and hopefully swine flu is likely to disappear in a couple of days.
But it has taken quite a bit of toll this year.
Yeah, toll is taken. I told you the causes of toll. The toll is because of the sick patients who have come from Jaipur. I was seeing the other day, lots of patients came from Rajasthan to the Jaipur centralized hospital service. And similarly, the patients are coming late actually. When the patient comes late to the hospital, it is very difficult to contain the disease because the disease has spread.
Okay. Dr. Wali, the problem is that why should patients come from
rural areas?
Rural areas, Dr. Rajiv.
Yeah.
You know why? One is this patients, as you were saying that patients came from Jaipur. Why should they come from Jaipur? Jaipur doesn't have facilities. What are the facilities available for this? Are there shortage of facilities?
No, I said they are coming from Rajasthan to Jaipur, sir.
To Jaipur, okay.
You see, the way this is organized in principle is that the district hospitals and the state level medical colleges are geared to handle the worst of the clinical cases, particularly who will require intensive care support. However, the majority of the cases can well be treated at home, of course with support,
yes,
with frontline health workers providing that support, with primary level doctors being there and so on. So what you will see at the district level and the medical college hospitals are really those who need institutional treatment, which overall is a very small proportion. But if you see some of the media reports particularly, patients are arriving in an advanced stage of the disease from the far-flung rural areas of some of these states.
Which means they don't have facilities there.
Which means that something is not quite good
right, yeah,
at the front lines.
Or they are not identified.
They are not identified
yes,
also. Mr. Dalaria, how, your people have been also working on these issues.
Yes.
How, Why do you think this has spread so much this year? And do you see any shortcomings as far as the way these things have been handled at the government level, at the hospitals level?
I think we need to understand that but two things. One is that this disease is a viral disease. It's spread through droplet, infection that is through airborne. And the more important thing which is there is that we should not be panic about this disease, right? It can be very well prevented. The good thing is that the strain which is spreading is a similar strain which is there in 2009. We do have effective vaccines against this. All the trivalent vaccine available at the moment in the market are effective against this virus. There is a live vaccine also, which Serum Institute has. It is also available. Very effective live vaccine is there. So I think we need to take care of more of prevention rather than creating a panic. My colleagues rightly said, that because of the prolonged winter this time, maybe this is the main reason why this disease has spread and have a high toll at this year. So this is the main reason. But I think that we need to take care that this should not spread. The isolation of the patient and the other people, they should take care of having a mask, having gloves, and then regular hand wash. These are the precautions other people has to take, and that will definitely help in preventing this disease of spreading.
Okay. Maua, you have been covering, you understand these things. So tell me, what has been, people are talking of preventing it. Why has it not been prevented? What has been the problems as far as the preventions are concerned? Do governments wait too long to handle this kind of things? As you were saying that when the Ebola scare started, we should have been talking about. Nobody talked about it.
Well, this has been a basic problem with most pandemics, that we wake up too late. The government wakes up too late. So only when the number of deaths or cases become really high, that's when they start.
I think we need to blame the media also. We also wake up too late.
Well, yeah, that's because we don't get information on time. But I think this awareness thing cannot be only seasonal or related to whenever an incident occurs. This has to be done every year. There should be awareness campaigns. And see, people reach late also not because there is no facility at the local level, but also because there's no awareness about this disease. They don't know that this could happen to us. So while the media is also playing a positive role if you look at it, because now we know about the problem.
Right.
So it's not that we don't know, but campaigns need to be done rigorously. It should be every year. The way we did with the polio thing, for instance. Ebola also, it went on. But for this, we've already had this in 2009. So why did the government wait so long to again create awareness in the public?
In fact, the numbers which I have here says that in 2012 there were 405 deaths, and in 2013 there were 218 deaths. So it is that we have been having, this is the highest ever so far. So I guess the panic is understandable.
Yes, because 2009 there was a lot of awareness because it happened for the first time.
Right.
But over time we forgot about it. The government did not bother about creating awareness. This could happen over and over again. Like for instance dengue, initially again the government had forgotten, but now there has been a constant campaign happening about dengue during the season when it's supposed to start. So but with H1N1 they have not done that at all, and in the future it's not enough to say that this will happen again next winter.
Yes. But what are the kind of measures you will take? Dr. Wali, the question is this, that now we are hearing about the kind of exploitation which is happening in the of people, the high costs of
testing and all
and
that.
the high cost of medicines, high cost of injections.
Yes. Even people are just queuing the chemist shops just to have the medicine so that they eat because their neighbor had swine.
So, that is what, so the awareness, the question of awareness about this disease has not been done enough.
I'll give a solution to this, sir. As she said, we have to do swine flu seminars, talks, school children to be educated every September. In northern India, when the winter starts setting in, and we start cases of...
So, what you're saying that this is unavoidable, this is not preventable.
This is unavoidable, sir.
This virus is going to be there for quite some time.
Influenza-like illness is known for ages. H1N1 is an addition of 5% to the influenza-like illness which every common man has every year when the winter sets in. 1 to 2% cases of H1N1 are fatal, which are very rare, and even less. I have just exaggerated it. So very small numbers are fatal, and if that number is taken care of on time, we can save 50% of them. Those people, as I will repeat, are not dying again, I will say, because of the per se swine flu. They are dying because of the comorbid conditions. In Delhi, the deaths are very less because Delhi was aware of it. Somehow.
And Delhi has facilities.
Yeah, facilities as well, but Delhi people were aware of it, they react fast, and we have good hospitals. Central government has done already the work which has come in force now, and the facilities which were there, patients have had it. It is true that the test is costly. It is also true that every patient does not require test. Let the doctors decide who requires test.
The patients themselves going to the labs and getting tested.
That is a problem, sir, what patients did this time, because the scare suddenly came up, they thought we should get tested. Even people call me, I have cough, whether should I get swine flu tested? I tell them, unless you have very high fever which is not responding to usual fever drugs, then you start thinking of this, go to your doctor. Otherwise, just take a simple pill, take rest, have a good nutritious diet, build up your immunity, don't mix up people, isolate yourself, and have some desi remedies like adrak ki chai, haldi wala doodh, and little bit of saffron in the milk, things like that which keep you warm. Actually, all these things combined would produce good results. The only thing which I would suggest for future is that they start awareness campaigns everywhere when the month of September arrives.
Okay.
That would do a great magic if you try this next year.
Rajiv, the question is this. We are now talking of, there have been reports saying that there is shortage of drugs. And one of the reasons why there's shortage is that apparently the chemists don't want to keep it, because last year they kept a lot of drugs and then they found there was not much demand, they had to destroy it. Apparently this drug which is Tamiflu,
Yes.
it is under Schedule 10, and there's a lot of
Schedule
X, and there's a lot of problems as far as the chemists are concerned in storing
See,
them.
it's a Schedule X drug. The central government has put up, is on its way to put up on its website the chemists in each of the states and cities who have been licensed to have storage for these drugs. In addition, what the government is geared up is to make it available at the state and district level hospitals, but this is to the extent possible. Unnecessary or over-prescribing this is also going to add to the crisis,
Right.
which is quite aside from a black market that possibly or most certainly exists.
Yes, it is there, it exists.
Yes. So a great degree of regulation is needed on behalf of the state and the central governments, because ultimately neither the supply is limitless and nor one should have unnecessary use of it because it contributes to resistance, and only a relatively small proportion, which is fairly well categorized by A, B1, B2, C. In that categorization, a relatively small proportion will need the drug. And this is equally true of testing. Not everybody will require a testing, and therefore, as Dr. Wali was pointing out, it is very important that doctors also practice the correct form of medicine, prescribed in a correct manner, and that's how we'll have to move along, because it may be erroneous to believe that once the temperature rises, it will go away. Tails of the epidemic can be pretty long.
Relapses?
Can happen.
Dr. Wali?
Yeah, relapses, one suffers from swine flu is not likely to have it again unless the virus changes the strain. Relapse is not that common. What is common that after swine flu, the patient gets weak, some other disease may attack him.
Because of the lack of immunity.
Lack of immunity or weakness, followed by any viral illness, there is a lot of weakness in the body. So everybody feels very fatigued, tired. The best solution is to take rest. Stay at home. Even children who suffer from that, the mother should not send the children for 10 days to the school, because they may be contagious to the other children. So what I am trying to tell, what I was trying to tell, that tale of epidemic apart, that we should not scare that it's going to rise. That is my message. It is probably not going to rise anymore. Central government has taken action appropriately. Delhi state government has taken action much before time, much before we started talking it on media. the government was in action. Health Secretary took meeting, our new minister, Union Health Minister, Delhi Health Minister have taken cognizance of it. So everybody is in the job.
No,
The problem
despite
comes...
taking cognizance that this number of deaths
They
have
can't
gone up so
contain the
much.
virus. It is not a rat. You can catch it into the rat catching box. It is a virus. It is not visible. You see where it is going. The crowds are enormous in India. Everywhere the population explosion is responsible for 50% of our problems.
There is another problem, Maua. You know, the problem of medicines, the problem of testing, and this huge exploitation which is happening among the... Have the governments woke up to it late? Because only Delhi government have now fixed the price at 4,500 rupees as far as tests are concerned. But we are hearing in other states, you know, this kind of exorbitant costs are still happening.
Yeah, well, there are a couple of things. First of all, as we were discussing, we don't know how big the problem is because we don't have any kind of epidemiological study as to what is happening, how many people are actually affected.
We are told 10,000 people are affected.
We don't know because where's the data? We are just getting it based on how many people have reported to the hospitals because there could be so many more and deaths could be higher. But we don't, the government does not look at that at all. So that's one problem. In terms of medication, because of the fear factor, people are just arbitrarily taking a lot of drugs.
They are not supposed to.
They're not supposed to.
And unless they have prescriptions, they are not supposed to be given.
As Dr. Wali said, a lot of people are calling and say, should I vaccinate my child? Should I take these drugs because I have fever? Or maybe I don't, I might just get it. So all these things are happening and this is not being addressed by the government at all. So we are just saying that, okay, we are doing something, but what is being done is not very clear by the government. So this regulation, as Rajiv said, is very critical. That is not happening.
So the other thing is it's one thing to have an awareness campaign. An awareness campaign is a relatively passive thing.
Yes.
And there are more active social mobilization strategies, which is a dynamic strategy, which reaches out to people, which takes care of changing perceptions and therefore addressing it on a real-time basis. Now, that's very crucial, and the Ebola experience has shown that this dynamic plan is actually extremely critical in responding to very nuanced community perceptions, community practices,
who is supposed to do it?
Yeah. Now, the health service simply doesn't have those soft skills. These are a range of soft skills. In the case of Ebola, for example, UNICEF contributed in a very major way in the African Ebola hit nations. So it's a whole lot of soft skill that goes along with preparedness in terms of, say, ventilators and drugs and masks and so on. That's one kind of preparedness. But addressing these soft areas is another critical area where we simply are non-existent.
Okay, Mr. Dalaria, can we say that only only governments need to take care of it? What about the private NGOs like yours, or people who are working in this in this field? How effective? What kind of effective awareness campaigns, or as Rajiv says, soft skills are being given to people?
I completely agree with what Rajiv is saying. And NGO like PATH and other NGOs, we do have track record of supporting the government programs. Basically, the mass awareness program, which either maybe it is in the polio we had demonstrated it. In Japanese encephalitis, we have shown that it is so I think community awareness is the one factor which can really help in prevention. Number two is that effective vaccination. We need to understand that the effective vaccine is available. All trivalent vaccines are effective against this virus. We have live vaccine also. So that also, and people need to make aware that that there's nothing to be panic about it. And going to the chemist and taking the drugs, that is you need to understand that drug is only for the cure. It is not for the prevention.
Right.
So these kind of campaign, these kind of messages, they should be taken at a mass level, and the organization like the development partners definitely will help the state government and the national government in helping in carrying out these kind of campaigns.
Okay, Moa, we are now also hearing that I want Dr. Wali also to come in on this. We are now hearing, I've been reading reports that the health workers who are involved in providing, they themselves are not being, there is no clarity whether they should be vaccinated, they should be, because there seems to be a panic among the healthcare workers themselves.
That's right. Yes, that's true. Earlier there was, they had all these preventive gears also were given, drugs were given, all of that, but they don't have it right now. So they themselves, obviously, the whole fear factor works for them also. They're also exposed, and the fact is they're also treating people.
Right.
So when they come, so they themselves are at risk.
Have you come across cases where healthcare workers have got affected by
Yes,
this
yeah,
virus?
there are cases.
Dr.
Yes,
Wali?
yeah.
Yes, sir. It has happened to a few doctors. I will not name the hospitals where it has happened. But you see, our education also depends on where we wake up late. It's very funny, sir. I vaccinated a few subjects whom I know in the month of September and October, knowing fully that they should be vaccinated, and this vaccine
So what kind of people, how did you choose to vaccinate these people,
Sir,
and why didn't you vaccinate others?
There are two ways to approach this question. One is as a conscientious approach. Every adult immunization program should include H1N1 vaccination every year. Okay. Not possible.
That has to be at a policy level. The decision has to be taken at a policy level.
But elderly above 60, children below 5 should be duly protected at the commencement of winter. Every 2 years, pneumonia vaccine should be given to the same group of population. But health workers, I would say all of the health workers who deal with these cases, especially in the medical wards of all the hospitals, should be immunized. And at the beginning of the season, there is no shortage of vaccination. The shortage is viewed now very seriously, but at the beginning months, there was no shortage of vaccination. And companies do collect, these are very wise companies. They just collect the statistics of their sale and they produce accordingly. They do not flood the market with vaccines.
But the complaint of some of these companies last year was that they had so much stocks and they had to destroy them because, expiry.
Well, they should not feel sad about it. So many things are destroyed. You see, the human health is more. If one life is saved by a vaccine in the country, the whole production of the vaccine come, what may the investment is utilized. You see, this approach is wrong. Money and life can never be compared. This approach is absolutely ridiculous. If so many things, the stocks are taken back. Sometimes a car gives wrong service. The international companies withdraw thousands of cars. This is no question. I mean, and they are so many times, the production cost of vaccine must be very little. They have already made so much profit by R&D cost put in the vaccine.
Okay.
This point, I am serious about it, that we should not fear in medicine things that we are not going to use them in future, so don't produce. Where do we produce now when we need it?
That's one of the reasons why there was shortage of vaccines at this point of time.
If this is the reason, this is a stupid reason. This is a stupid reason.
The government didn't tender on time.
There's a huge problem over the years. This has been a problem. The tendering happens too late. Like you saw with the tuberculosis thing, the drugs came too late. There was a stock out. So that is a major problem.
The only answer to this problem, sir, is that we should wake up early for these diseases. Since now we know these are seasonal problems.
This is a seasonal problem. Rajiv, a larger issue of health budgeting, there are two. If you look at the health budget, just 0.29% of the GDP is allocated for health, and then even in that allocation, at least what I have seen is about 34% of the budget remains unspent. What happens?
In fact, in the revised budget expenditure, 6,000 crores has been cut in the current financial year.
Right.
It's a very long and complex story.
It's a tragedy.
However, in brief,
on the one hand, we keep having these problems. People, most of the people, I guess, who are affected by are poor people because their immunity levels are.
Yes, most of them are poor people.
Right.
They need free medical aid.
A whole lot of strengthening needs to happen in the primary healthcare sector, in addition to supporting the secondary and tertiary, the medical colleges and so on. Also, in the past years, the private sector has also supported during such emergencies in a limited manner. That's something which also needs to expand. Otherwise, there is always this notion that infections are treated in infectious disease hospital and it's the state's burden.
Absolutely.
So a right mix of public and private is necessary. The private sector will also need to step in at these times. However, a whole lot of strengthening of the public health services will certainly require not only budgetary support, but also an overall strengthening of the system. The system strengthening is something which is both human resource intensive as well as financially intensive.
Moa, as far as the governments are concerned, this kind of cutting of the health budget, when itself is something but scandalous, but at the same time, why do allocated funds don't get spent?
Well, at the state level, that's the biggest problem. The focus is very sort of limited. You know, there are only certain areas they will spend the money on, but they're not looking at it in a larger picture. So that has been a real problem, that states don't. I'm not saying all states, but eastern or central India, that's where the budgets are not spent too well, and that's an issue that has been raised for quite a long time now. But somehow that has not got addressed properly by the state governments.
Okay, but Mr. Delaria, as far as what Rajiv was talking about, both the public and private medical systems need to come together to handle this kind of crisis. How much do the private hospitals, private entities, you know, come forward and help in controlling this kind of, you know, what has now become some kind of an epidemic?
Yes, I agree. The private sector also and the development partner, they should come together to help government and work together to see that effective prevention campaign is in place. And I completely agree with one of my colleagues who is saying that that government has to now put in place the adult vaccination program. We have done this for other disease. Japanese encephalitis earlier we were vaccinating 1 to 15 years, but now in West Bengal and Uttar Pradesh and Assam, the cases are more in adults. So government is now going and putting a program for adult vaccination in place. So I think we all need to work together and see that an effective campaign is there and people are aware of this disease. I think that is the only solution.
Okay, Dr. Wali, very quickly, last words. Are the government hospitals in this country, or at least in the states where we have seen this problem, are they fully equipped to handle this kind of problem?
They are fully equipped, sir.
And how much does the private sector come into play?
Private sector gets scared of such diseases that if they admit the patients of swine flu, their other patients will fly away, saying that swine flu patient is there in such and such X hospital, don't go there. This is the thing which prevents it, although this is not the case. Isolation is the golden word which I say. If you isolate the case, take part in the campaign.
Do we have enough isolation wards in government hospitals?
Government hospital, yes, we do make. And one of the hospitals, one of the correspondent rang me up the other day that he went and there was no case in that ward. That means it's a good system was in action. That no case of this extent was there, although ICUs are full, because of the nature of the patients who are suffering from comorbid condition, not because of isolated swine flu cases. But the swine flu cases who need to require admission was in a government hospital of Delhi administration. The whole ward was, nearly whole ward was empty. So that speaks of a good care, good arrangement.
Okay, but the private sector is still not prepared to take care of this.
I would bluntly say that they is scared of this type of illnesses and they say go to government hospital.
Okay.
I'm sorry to say this, but please accept those cases, keep them separately, charge them and treat them and get a good name.
Okay.
I mean, nobody is going to give you money if he's treated in a private hospital. Just swine flu diagnosed, refer to RML hospital, things like that is not correct, sir.
Okay.
RML hospital doctors are also human beings. They need rest also.
Okay.
They can't handle the whole load of the capital.
Okay, sir. I think on that note we need to end. This is Dr. Wali assures us that this is a virus which is on the decline, but again next year we'll face the same kind of problem. Hopefully the government and all who are responsible will wake up at the right time and see that next year at least we will not see this kind of a problem which we have seen. Thanks to all my guests, Dr. Wali, Rajiv, Maua Chaudhary and Dalaria. Please keep watching.